Good afternoon, everybody. So we will be starting our technical session too, that is the afternoon session. And the chairperson for this session will be Dr. Dhananjay Bansal. And I would like to give a brief introduction about Dr. Dhananjay. He is currently a professor in the Department of Public Health and Mortality Studies at the International Institute of Population Sciences, Mumbai. He has also served as an assistant professor at the Population Research Center in Institute for Social and Economic Change, Bangalore. He holds a PhD from International Institute for Population Sciences, and his area of research includes aging, public health, large-scale survey research, maternal and child health, workers' issues in the unorganized sectors, HIV/AIDS, and health-related issues. He has published several research papers in the area of population and health-related areas. He is one of the PIs of the National Family Health Survey under Ministry of Health and Family Welfare, Government of India. Over to you, sir.
Yeah, thank you, Divya, for these introductions. Let me start the session. So today we have this is, I think, technical session 2. Yeah, and we have 5 presenters. So let me start with the presenter, Dr. Nirmala. You will get a 15 minutes, maximum of 15 minutes, and you need to manage the timeline because we may have some more sessions lined up. So just to maintain that, we have to just stick to our time, and the question answers will be at the end of the sessions. And if you have anything or anybody wants to ask questions, they can even note it down or write it down in the Q&A sections, or they can also put it in the chat box, and that will be asked once the session is over. Yeah, over to you, Dr. Nirmala.
Yes, sir. Thank you, sir. Good afternoon, everyone. I'm Nirmala Arich, research scholar from Karnataka University, Dharwad. Thank you for giving me this opportunity to speak in this virtual symposium. My paper title is Quality of Life of the Elderly Population in Urban Areas of Haveri District, Geographical Study. Often these senior citizens are considered as forgotten generations because of some of the stereotypes such as senility, fertility, unattractiveness, ageism, and due to like urbanization and migration as well. When it comes to geography of aging or gerontological geography, it is known as this, it analyzes the socio-spatial dimensions of population aging, which impact in the life of older people, as well as demographic transition and this population aging are both are interlinked with each other, which helps in understanding relationship between physical environment and older people. Significance of the study, the quality of life of these elderly people, it refers to the overall well-being, their satisfaction and happiness, which in their later years, when this paper is, if the paper is concerned, this Haveri district is usually a backward district of Karnataka state, and quality of life of these elderly people are affected, and they are socially and economically challenged, and it's an it also consists the challenges which are faced by elderly people. This is the map of Haveri district. It consists of 1.6 lakh people of elderly people. Objectives of the study: to access the quality of life of elderly people in urban areas of Haveri district, to identify the key dimensions influencing quality of life, to examine the impact of socioeconomic factors on quality of life, to to develop targeted intervention and policy responses. Database and methodology of this study. Database is through primary data, questionnaire, and the sample size of the study is 204 elderly individuals, which consist 138 male adults and 166 female adults, elderly adults. Composite index is used to measure the quality of life. Also, bar graphs are used to give idea about quality of life of elderly people. This table shows the age of the respondents of elderly people in urban area, which consist 35% of 60 to 65 age group, which are major in urban area of Haveri district. This table shows about the level of education of older adults, which shows that major older adults have completed primary education, which is till 7th standard. Why? Because as they are from agricultural background, also women education is not given that much importance. Also, there are early dropouts. Due to this, they have only studied till 7th standard, which makes them as less educated. And when we come to status of occupation, there are major number of people are non-working in this district. Health status of these older people, they have excellent health status, as they have increased medical facilities as well as growing importance about health and medical facilities. The as we can see that the present graph shows about their health center visit. They usually visit monthly. When it comes to nutritious food, they intake excellent nutritious food. Sleep quality, there is good number of people who have good sleep quality. Leisure time, they majorly watch TV when they have leisure time. Social contacts, they have more number of friends, relatives, and neighbors when it comes to social contacts. Family status of the respondents, major number of elderly people live with their children, also with spouse and children. Family members take care of the elderly people very good, and it's 54.41% of elderly people have good number of what family members who take care of them. Lonely or isolated, only 25% of the people feel lonely, and 75% of the people are doesn't feel lonely or isolated, because they have surrounding people who they can connect with, and they live with their grandchildren as well. This is about the safety and security. The safety and security of this elderly people, it shows about 45.58%. Freedom in decision making, it's about 50-50. Some have free to make decisions, and some are not free to make decisions in their family. When it comes to economic status of elderly people, economic status is good enough of the elderly people in Haveri district. Source of income, major source of income of elderly people is from government schemes, which they get monthly 600 to 1,200. And the status of house, major people have their own house compared to rented house. And this when type of house is concerned, they have majorly Pakka houses, which is 67.64%. And when it comes to ownership of property, many people have house as well as house, farmland, and site of their own property. This one is last table, which shows digital and technology. When they have very less number of people who use mobile phone. In that, especially male older adults uses smartphone as they have more knowledge and they are well educated. And when it comes to female, there are major number of women who doesn't use mobile phone as they are less educated, and also they don't have any knowledge about digital and technology. And some 50-50 people uses keypad mobiles. This table shows about the composite index, which is used to measure the variables, and composite scores are given for each variables: this level of education, source income, their economic status, ownership of house, their health status, mental status, family status, care of family members, security, freedom in decision making, and digital technology. And using those all variables, the levels of quality of life of these elderly people is calculated. This present study of quantitative analysis gives the idea about level of quality of life, which is grouped into 4 levels: high level, moderate level, low level, and very low level. This table, we can see that male older adults have very high level of quality of life, whereas female older adults are in low level as they are dependent on their children. They don't have proper education, and also they are not socially connected to outer environment. Conclusions and suggestions of the study. The study's findings underscore the complexities of these elderly people, and which are related to economic disparities, limited healthcare access, mental concerns, and loneliness. Also, quality of life is concerned. There are, as I told, male have very good high level of quality of life compared to female. When it comes to suggestion, strengthening of primary healthcare infrastructure should be implemented. This elderly friendly infrastructure should be done. Also, economic improvement of schemes should be done, and to promote, there should be a promotion of intergenerational programs. I thank everyone for listening my talk. Thank you.
Thank you, Nirmala, for